With a first patient that will never be forgotten, today begins the med school journey.
These students are brand new. They can't wait to absorb knowledge, and they're all wide-eyed and just bushy-tailed and just loving what they're doing. First day is great.
It is a special kind of privilege to be able to work, with these bodies, and I kind of consider them sort of our first patients.
It didn't actually even hit me until we had that moment of silence in the beginning, and it hit me that I was actually here.
So it was nerve-wracking to say at the least because I've never seen a cadaver before.
So clearly the anatomy hasn't changed a great deal since Dr. Davidge's time. We are still learning the vascular branches, we are still learning the joints, we are still learning the ligaments.
The first incision wasn't easy, but it was probably the greatest thing I've done thus far in medical school.
Making that first incision was definitely pretty hard.
What we need to do in many cases is find palpable landmarks. A lot of what students ask on the first day is this right? Am I doing it correctly? Because they're so diligent and so interested in being perfect that they can be a little tentative initially.
My teammates were really supportive, and they were encouraging me and then helping me make adjustments.
How deep should I go? Is the scalpel right? Is this a muscle? Am I in fat? Am I in muscle? What muscle is this? What should I do?
When you step back and you just realize what you're doing and how just exceptional and out of the ordinary it is what you're doing, it's really a thrill and an honor.
I just love doing this because they're so, tell me, show me. I can't wait to soak this up.
For School of Medicine graduates, now faculty, memories of the first day remain vibrant.
And I think that first day in anatomy lab really stands out for almost anybody that's gone through medical school.
Sort of awe-inspiring and overwhelming walking into that anatomy lab the very first time.
I think I had the thought of, oh my gosh, I can't believe I'm actually doing this now.
I think I learned very quickly that I wasn't cut out to be a medical examiner, but I knew that what I was learning was going to be important.
Absolutely. I remember my first incision. It is actually in the anatomy lab that I first developed the seed of a notion that I might become a surgeon.
Once medical school students, now faculty, the education they received has been the blueprint for their careers as clinicians, researchers, and educators.
We're teaching what you need to know to take care of somebody. And no patient ever asks, what grade did you get in structure and development? No patient ever comes to you and asks, what is the left branch of the iliac? They come to you and ask the most important question that I think our students need to be able to answer, and that is, can you help me? And through this course, I'm hopefully giving them the information they need to answer that question with, yes, I can.
I love emergency medicine. I think the ability to see a patient when they come in with just a symptom rather than having a specific diagnosis and being able to care for them, many times on one of the worst days of their lives is such a privilege.
I think it certainly is very exciting to take some of the technologies that we use for other cancers and apply them to breast cancer, especially because breast cancer is the most common cancer for women in our country.
Family medicine is a privilege. I get to do everything, and it keeps me on my toes. The rewards are the joy I get to have coming home at night, knowing that I made a difference for people.
I've worked on national organizations, surgical organizations, and I think I take pretty good care of my patients, which I think I'm most proud of.
When I was offered a position to be here at university as a faculty member and to know that I could continue to learn from some of the faculty who had initially inspired me, that was, to me, such a dream come true to get to work with such incredible humans.
For students at the beginning of the journey, looking to their faculty, they see the world of medicine that lies ahead.
It was really amazing and just eye-opening, and excited for the rest of anatomy and the rest of med school.
This started putting everything into practice and made it feel like we were actually in training to be doctors and eventually working with patients.
I see them succeeding in whatever they choose to set their mind to.
Class of 2022, you're going to do great, and I wish you well. Good luck. All of a sudden, you're graduating. All of a sudden.